The healthcare tragedies that I witness will not be prevented by insurance exchanges, tort reform, electronic medical records, or any manipulation of the private health insurance industry. 500 Oregonians, you've heard already and know, die each year because they have been denied health insurance, either because of cost or pre-existing conditions. This incentive to avoid risk diverts up to 40% of healthcare money into wasteful bureaucracy of paperwork, phone calls for authorization and payments. It fragments our healthcare efforts and confounds our ability to measure or control our healthcare needs and outcomes. House Bill 3510 would create a single risk pool and thereby solve the problem of excluding those who need care the most.
It slows things down. It stops working people in Oregon from being able to, in good times, receive wages, in bad times, prevent cuts, because they're trying so hard to hang on to the health care that they have and not lose coverage for themselves and their families.
My name is Mark Hillenbeck, and I appreciate the opportunity and privilege to address you today. I am the founding co-principal of Cascade Management, a 23-year-old affordable housing and care management company. We have over 350 employees providing services in 32 cities and to over 7,000 residents. When I began in business in 1988 as Hillenbeck Property Management, the predecessor to Cascade Management, we provided full medical coverage to all of our employees and their families. By full coverage, I mean major medical with a $150 annual deductible, prescription coverage, vision, and dental. Today, 23 years later, we provide coverage to our employees only, no longer cover their families, no longer pay 100% of the premium, with our employees paying 18% of the medical premium and 100% of their dental. Today, our employees face an annual deductible of $2,000, 80% of the coverage with a stop loss of $4,000. So dramatic difference in 23 years.
My name is Frank Erickson. I'm a board-certified radiologist in rural eastern Oregon. I'm 30 years out from medical school. I've spent the last 15 years in Pendleton as a radiologist. I believe Oregon's version of single-payer / what we call now single risk pool healthcare, presented as House Bill 3510, provides us with the tools to cure a variety of ills created by our current for-profit malfunctioning health processing industry. I believe that as long as there are uninsured people in whatever healthcare system we have, there are going to be unnecessary avoidable deaths. So you have to like a bill that in the process of making Oregonians healthier and more productive actually creates an estimated 35,000 jobs. It eliminates over half of all labor disputes. It allows all of Oregon as a group to negotiate lower prices for pharmaceuticals and services, provides local management by district of administrative issues, something we don't have now. It gets every citizen equal access to basic medical and dental care and stops personal bankruptcies for medical misfortunes.
I want to leave an image with you that you'll remember. It's not this mug right here. It's my daughter, Tanya Ray. Tanya was born in Rogue Valley Memorial Hospital on March 19th, 1973. She died in the very same hospital January 31st, just 2 years ago. Tanya was diagnosed with leukemia in the year 2000. Insurance companies did not kill Tanya Ray, but they made her life miserable for 9 years. Every step of the way, she had to fight for the treatment that her doctors wanted her to have. But every step of the way, she had to fight the insurance company. She said, "Dad, I should be walking in Lithia Park. I should be working on my health instead of fighting the insurance companies." We can do better than this. We can do a lot better than this.